everyone, welcome back to the channel. My name is Yamama Jiburi and this is my friend Nazik. She also has a YouTube channel, by the way, which I will link somewhere here, I think. And we also filmed a video over her channel, so you should go and check it out. Basically, we were talking about our clinical rotations so far. So to introduce ourselves, we are fourth year medical students and we just started our clinical rotation in a 6-year MD program. So over Nazik's channel, we talked about our family medicine rotation, which we recently finished. But before that, we did 2 months of psychiatry, and let's talk all about it. So psychiatry, what did we do, Nazik?
So basically, we took it in 2 hospitals. First, the Al Masarra, which is a tertiary care facility for only psychiatry and with other stuff like sleeping disorders and that. And then we did it at SQU Hospital in the behavioral medicine department. Really interesting. 8 weeks.
Yeah.
1 week considered geriatric. Really fun.
Yes.
Yeah.
I also loved the rotation so far. I mean, we only did 2, but I loved psychiatry so much. Especially since a field that I was considering before, and I did love it, but I don't know, still like I have to experience more rotations to reach a final decision.
Yeah.
I think. Yeah. So mainly what we saw like lots of basically we saw almost everything except I think anorexia nervosa and Tourette syndrome. These are the 2 things I wasn't able to see. Oh.
Anorexia nervosa, because it's related to also internal medicine.
Yeah.
So that's why it was hard to see an inpatient.
But otherwise, we saw like a lot of patients with schizophrenia, bipolar, depression, anxiety, and also personality disorders, which was very, very interesting. The thing usually like we arrive there in the morning and then either clinic or inpatient. So in Masarra it was mainly inpatient. Yeah. So there were like the morning rounds, and then afterwards we can go and we take history from patients and perform a mental state examination. So which case actually was the most interesting for you? Like out of all the disorders we saw?
What's the most interesting is when it's a really, really crazy story. I can't say the details.
Yeah, you can, Mr. Jones or Mrs. Smith.
Then there was the patients who always resonate with me and I found interesting are the ones who are our age, like teenagers also, because you see yourself in their shoe, or you see yourself understanding them better. One of which was really conscious about his body status, and he was demanding the doctors to prescribe him protein shakes. I feel like that story with other details, it was really interesting. Other than that, a really interesting story was when we took a history of a patient with depression. We took history, we thought that it was depression. We came to the doctor, told him the whole history. He was like, what's your differential? Depression. He's like, no, think about something else. It turned out a personality disorder, which was a really eye-opener. Like, even though we took depression history, when the doctor said personality disorder, it made sense. It made more sense. Really interesting case. I think those are mine. What about you?
Again, similar. Like I think just seeing new cases. So for example, like the first time you saw someone with bipolar, the first time you saw someone with, personality disorder. But one thing is there was one patient, I'd say X, okay, had mental retardation, and I find like her story was quite touching, like how she's trying to cope and how she's trying to get support. So the idea is that support was really, really important in all those patients. So and the way I was from what I observed is that those who have excellent support from family or friends, they tend to do better than those who don't have a lot of support. So I think that was something, it's sad, but that's how it is.
Yeah, you could tell that all the patients had something in their childhood. When you dig more and ask them, it's sad that something in their life beforehand is affecting them now.
Yeah. Also, one thing is that mental health issues literally do not discriminate. Like we saw people from all different socioeconomic status, all different job backgrounds, like completely different ages. It's not like, that was like interesting. That's why we shouldn't judge people like, category X have it easier than category Y, whatever you want to call it.
Yes.
No, not really. Everyone does have their own struggles, even though we assume they don't. So that was okay. So what was the most favorite thing about the rotation and least favorite thing, in your opinion?
Favorite thing is actually hearing about their story, because that's what psychiatry is all about. Not favorite thing is that sometimes it's hard to always listen to stories.
Yeah.
Their stories. That's how you get into the differential diagnosis, and it's hard because you need to listen, you need to dig more, but sometimes you lose concentration in the middle, and you lose some key information. So it goes both sides. Also, favorite thing is that every patient, you learn from every patient in their story. There's always something you take with you. And I remember there is one patient, and it was really nice because we learned, he gave us his history, and he taught us like life lessons. He gave us advice. Really interesting patient.
Yeah. I'm not too different from you. My answer to that question. One of the favorite thing is that you have a lot of time with the patient. You're not restricted, especially as med student. Like I felt that we were more free there were no time restrictions into how much we can spend with a patient. I mean, of course you have to keep that in mind, but generally speaking, there was no time limit, which I personally liked. The thing I disliked was similar to what Nazik said about sitting and just paying attention, because it requires a lot of patience, especially since some patients, I can play on words anyway, when they have flight of ideas, and you need to remember, sometimes you tend to get sidetracked, but you need to remember, okay, what is my question now? So you tend to lose track. So that is important to be very concentrated and have a lot of patience, which is hard because sometimes you sit like an hour and I think our attention span needs to be improved. Okay. So I think lastly would be, what advice do you have for students who are going into their psychiatry placements?
Let me think about that this side.
Okay. For me, I would be like, first aid is amazing, okay, for psychiatry. Some doctors may not like it in the sense that it's not sufficient, which I understand. However, as a student, like, to get the basic info, if you just finish first aid and then if you have time, you can add more info into it. But I find it nice, concise, and like chapters are very short, so you can like do 5 chapters a day, depending on how much you have. And also AMBOS psychiatry questions, they were really great. I find that good. And the third thing is, the residents are your best friend. Ask them anything. They will help, even though you may think, oh, I was so stupid, like I don't know this. It's okay. Like, what's the worst thing they could say? They wouldn't say no. Like, I asked so many ridiculous questions, no one said no. They still were willing to explain, which is amazing actually. So always ask questions. It doesn't hurt. I mean, of course, put in the effort to learn and get your own info, but if you have a question, just ask. You'll remember it more than not getting the conversation you had will be more memorable. So
Yes.
trying to say regarding a question or something.
Yeah. For me, I would say beforehand, maybe try the first 2 days, see how they take history, and go do your own template of history, because
Yes.
the cases repeat themselves. So have a concise way to do history, and screening questions, very important. Memorize those by heart, and then for every patient who comes, try to take history. But as you know, in clinic there is a time slot, so try to take concise history only. Then don't worry about the examination. For example, when I did my long case, in which you need to take history from a patient and then discuss with the doctor, it was really fun. I really liked that patient. We talked. She reminded me as someone like my grandmother. It was really fun. We laughed at that. I even forgot that I had an exam and I needed to ask her. It was a really nice experience. Other than that, as Imam said, first aid is really nice. Also, AMBAS has they do have like a plan, right, for psychiatry. All the articles and all the questions.
Yes.
So go through them and try, maybe this will be hard, but try to prep. We do have presentations on Thursday about certain topics, so try to prep them beforehand, so that if you have any questions, ask the doctor, or if you and you get the information much better when you already had done it before.
And also one thing, when you take history, don't skip on questions like, for example, you think it's depression, but then it could be bipolar, it could be schizoaffective.
Yeah.
So make sure to ask. And something regarding the long case, in my long case, I had a patient who was doing ECT. So throughout the whole month, he was continuously doing it. So it was interesting to following up on the patient and seeing the progress.
Yeah.
So if you have the chance to do that, even if the patient, okay, you finished your task, you can still follow them up. Just keep checking on them and see, okay, how well they're doing, because that also gives you a good insight on, okay, how's the treatment working and what are the side effects of medications. You tend to remember them better than just reading them.
Agreed. Pharmacology is important.
Yes, that's the main
memorize.
main bits. Yeah.
Watch Sketchy for pharmacology. It will really help you. Try it. And anything more?
No, but not that I can think.
Just please consider have time management and always be on time. Being on time, as they say, being on time is always late. So be before before the time. Attend the morning meetings. Really interesting.
Attend the morning meetings. It's great. And also, they tend to give you information actually about the patients that you will see later on.
Yeah.
So at least you kind of get an extra prep.
Exactly.
Compared to if you don't attend. So.
And don't shy away from even interacting in the morning meeting, because at the end you're part of the team. Don't forget that. Don't say, I'm a medical student, I will sit in the last row and I will not talk because I haven't earned that. No, you are in the team. Sit in the front, engage, ask questions if you have. You already do have much more information, so maybe you could also help manage those patients.
Yeah, but they say you get how much you give. So.
Yeah, always ask. If the doctors are busy, they won't give you time if you don't ask for it. So engage, show them that you care, show them that you want to be helpful in clinic, help them take history, write notes, talk to patients, and they will give you much more when you start the initiative.
110%. Yeah. Thank you, Nazik. Okay, sorry about that. All right then. So that sums up our video. Again, check out Nazik's channel. I will link it. And yeah, thank you. If you have any comments or any remarks regarding your experience in clerkships or placements, whatever you want to call it, just comment them down below. And yeah, see you next time, I suppose. Have a good day and take care. Bye.